What if second-generation antipsychotics don't work? Have you ever wondered what happens when second-generation antipsychotics do not provide the relief expected for schizophrenia? This is an important question for many individuals and their families. Second-generation antipsychotics, also known as atypical antipsychotics, are commonly prescribed to help manage schizophrenia. They primarily work by blocking dopamine receptors and also influence serotonin receptors. This helps reduce positive symptoms like hallucinations and delusions. However, they may not fully address negative symptoms, such as social withdrawal or lack of motivation, and cognitive challenges that some individuals face. If these medications do not work effectively, the first step is to assess the treatment response. It is essential to determine if the medication was taken at the right dose and for a sufficient period. Sometimes, what seems like a lack of response might be due to insufficient treatment time or incorrect dosing. If the first medication does not seem to help, switching to a different second-generation antipsychotic may be an option. Each medication has its own effectiveness and side effect profile. Some patients may respond better to certain drugs, like Clozapine. This medication is often used for treatment-resistant schizophrenia and has shown strong evidence of effectiveness when other options fail. In addition to switching medications, considering third-generation antipsychotics could also be beneficial. These newer medications work differently by partially stimulating dopamine receptors. This may help improve negative and cognitive symptoms that second-generation antipsychotics do not adequately address. Another approach is to add adjunctive therapies. Non-antipsychotic medications, such as mood stabilizers or antidepressants, may help with symptoms that antipsychotics alone cannot manage. It is also important to consider psychosocial and supportive interventions. Medication is just one part of the treatment plan for schizophrenia. Psychotherapy, social skills training, cognitive remediation, and supported employment can all improve functioning and quality of life, even when medications are not fully effective. Monitoring side effects is another key factor. Side effects from second-generation antipsychotics, like weight gain or sedation, can impact a person's willingness to stay on medication. If side effects are severe, patients may stop taking their medication, which can look like treatment failure. Addressing these side effects or switching to medications with fewer risks can lead to better outcomes. For those who struggle with daily medication adherence, long-acting injectable forms of antipsychotics can provide a more stable drug level. This can help reduce the risk of relapse and ensure that the medication is consistently in the system. In summary, if second-generation antipsychotics do not work as hoped, there are still many options available. Treatment-resistant schizophrenia requires careful reevaluation, potential use of Clozapine, consideration of newer medications, and incorporation of psychosocial supports. The goal is to tailor treatment to each individual's unique symptoms and needs to improve overall functioning and quality of life.